Now the pharyngeal wall. The pharyngeal wall consists of four layers. The first innermost is the mucus layer, mucous membrane. Then we have the pharyngobasilar fascia. Then we have the muscular cord that consists of superior constrictor, middle constrictor and inferior constrictor, and outermost is the buccopharyngeal fascia. The mucous membrane lining the pharynx consists of considerable amount of elastic tissue. Now, pharyngobasilar fascia, it is a fibrous thickening of submucosa. It lines the muscular coat and is thick near the base. It is thick near the base of the skull. The pharyngobasilar fascia is thickest in the upper part, where it fills the gap between the upper part of the superior constrictor and the base of the skull, and posteriorly it forms the pharyngeal raphe. Now, muscular cord outer layer comprises three pair of circular muscles called constrictors, superior, middle and inferior. The inner muscular cord comprises three pairs of longitudinal muscles. Now, buccopharyngeal fascia, it is inconspicuous fascia which covers the outer surface of the constrictor muscles. In the upper part, it is also prolonged forwards to cover the buccinator muscles. Above the upper border of the superior constrictor, it blends with the pharyngobasilar fascia. Now, what is Waldeur's lymphatic ring? It is the aggregation of lymphoid tissue underneath the epithelial lining of the pharyngeal wall. It is called tonsils. It surrounds the commencement of air and food passages. The Waldeur's ring is formed by the pharyngeal tonsil. This is the pharyngeal tonsil, posterior-superiorly, lingual tonsil anteriorly, tubal and palatine tonsils laterally. Waldeur's ring prevents the invasion of microorganisms from entering the air and food passages and help us in the defense mechanism. Now, constrictor muscles of the pharynx, that is the superior, middle and inferior constrictors, are arranged like a flower pot without base. These are placed one above the other. Inferior is placed on the middle constrictor and middle constrictor is placed on the superior constrictor. The constrictor muscles form bulk of the muscular coat of the pharyngeal wall. They arise in front from the margins of the posterior opening of the nasal, oral and laryngeal cavities, and they pass backwards in a fan-shaped manner into the lateral and posterior wall of the pharynx to be inserted into the median fibrous raphe on the posterior aspect of pharynx. Now, what is pharyngeal pouch or Zenker's diverticulum? There is a potential gap posteriorly between the thyropharyngeus and cricopharyngeus, that is known as cricopharyngeus and thyropharyngeus. These are the parts of the uh, uh, inferior constrictor muscle consists of two parts, thyropharyngeus and cricopharyngeus. So there is a potential gap between these thyropharyngeus and cricopharyngeus. Sometimes the mucosa and some mucosa of the pharynx may bulge through this weak area to form a pharyngeal pouch. So this is the pharyngeal pouch that is consists of the mucosa and submucosa that bulges through the thyropharyngeus and cricopharyngeus parts of the inferior constrictor muscle. So this is known as Zenker's diverticulum or pharyngeal pouch. Now, gaps in the, you can see on the radiograph, this is the pharyngeal pouch. Now, there are gaps in the pharyngeal wall. there exists four gaps on either side in the pharyngeal wall. The gaps and structures which pass through them are, now there is a gap between the superior between the base of the skull and the upper concave border of the superior constrictor muscle. Now this is known as sinus of Morgagni. This is known as sinus of Morgagni. The structures which pass through this gap are the auditory tube, levator palative muscle, ascending palatine artery, and palatine branch of ascending pharyngeal artery. Now there is a gap also between the superior constrictor and the middle constrictor, and the structures which pass through this gap are the stylopharyngeus muscle and the glossopharyngeal nerve. And there is also a gap between the middle constrictor and the inferior constrictor, and the structures which pass through is the internal laryngeal nerve and superior laryngeal vessels. And there is also a gap between the inferior constrictor, lower border of the inferior constrictor, and the esophagus, that is known as tracheoesophageal groove. In the tracheoesophageal groove, that which consists which the structures which pass through this is the recurrent laryngeal nerve and inferior laryngeal vessels. Now after the constrictor muscles, we have a longitudinal muscles of the pharynx. These run longitudinally from above downwards to form the longitudinal muscle cord, and this longitudinal muscle consists of stylopharyngeus muscle, palatopharyngeus muscle, and the salpingopharyngeus muscle. They elevate the larynx and shorten the pharynx during swallowing. At the same time, palatopharyngeal sphincter formed by some fibers of the palatopharyngeus muscle closes the nasopharyngeal isthmus. Now nerve supply of the pharynx. All the pharyngeal muscles are supplied by the cranial root of accessory nerve, except the stylopharyngeus, which is supplied by the glossopharyngeal nerve. Now sensory supply of the nasopharynx is by the pharyngeal branch of pterygopalatine ganglion. Oropharynx is by the glossopharyngeal nerve, and laryngopharynx is by the internal laryngeal nerve. Now arterial supply of the pharynx. Pharynx is supplied by the ascending pharyngeal branch of the external carotid artery, ascending palatine and tonsillar artery from the facial artery, greater palatine and pharyngeal artery from maxillary artery, and lingual artery from the external carotid artery. Now palatine tonsils. Palatine tonsil, there are two palatine tonsils. These are commonly known as the tonsils. Each tonsil is almond shaped mass of lymphoid tissue situated in a triangular fossa. It is situated in a, this tonsil is situated in a triangular fossa of the lateral wall of the oropharynx between the anterior and posterior fosses. The anterior pillar is formed by the palatoglossal arch, and the posterior pillar is formed by the palatopharyngeal arch. Now boundaries of the triangular fossa. Anteriorly is the palatoglossal arch containing the palatoglossus muscle, and posteriorly is the palatopharyngeal arch containing the palatopharyngeus muscle. The apex is towards the soft palate where both arches meet, and the base lies on the dorsal surface of the posterior 1/3 of the tongue. Now the lateral wall, there lies the superior constrictor muscle. Now tonsillar bed is formed from within outwards by the pharyngobasilar fascia, superior constrictor muscle, and the buccopharyngeal fascia. The tonsil presents medial surface It is free and bulges into the oropharynx. It consists of the cryptus. Now the lateral surface, it is covered by well-defined fibrous tissue that is here, uh, which forms the tonsillar hemicapsule. This is the hemicapsule of the tonsil. Between the capsule and the bed of the tonsil is the loose areolar tissue that is known as peritonsillar space, which makes it easy to dissect the tonsil in this plane during tonsillectomy. So it is also a site of collection of pus that is known as peritonsillar abscess. The superior constrictor muscle separates this surface from some structures which are, this is the superior constrictor muscles. This separates this area from some structures which are the facial artery, and it is two branches, the ascending palatine and the tonsillar artery. Another is the styloglossus muscle. Styloglossus muscle, this is the styloglossus muscle. Styloid process, angle of the mandible and submandibular salivary gland. The internal carotid artery, it lies about 2.5 centimeters posterior lateral to the tonsil. So the anterior border presents underneath the palatoglossal arch. Posterior border lies underneath the palatopharyngeal arch. Now, arterial supply of the tonsil. The arterial supply of the tonsil comes from the tonsillar branch of the facial artery. It is the principal artery and enters the lower pole. It enters the lower pole of the tonsil by piercing the superior constrictor muscle. Another is the dorsal lingual branch. Dorsal lingual branches of the lingual artery. Another is the ascending palatine artery. Ascending palatine artery from the facial artery. Another is the ascending pharyngeal artery, a branch of the external carotid artery, and the greater palatine artery, that is the descending branch from the maxillary artery. Now the vein is from the tonsil drain into the paratonsil vein. The paratonsil vein descends from the soft palate across the lateral surface, a lateral aspect of the tonsillar capsule, and pierces the superior constrictor muscle to drain into the pharyngeal venous plexus. Now acute tonsillitis. The tonsils are the frequent sites of acute infection, especially in the school-going children. And this condition is called acute tonsillitis. It is mostly seen in the viral infections. It is rare in infants and persons above the 50 years of age. Now, after tonsil, we have important structure, that is the pharyngotympanic tube or eustachian tube or the auditory tube. It is a mucus-lined osteocartilaginous channel which connects the nasopharynx with the tympanic cavity. Nasopharynx with the tympanic cavity. It is divided into two parts: the osseous or bony part and the cartilaginous part. The bony part, it forms the 1/3 of the total length of the tube, that is the 12 millimeters. It lies between the tympanic and the petrous part of temporal bone and opens into the middle ear cavity. Another is the cartilaginous part. It forms the 2/3, that is 24 millimeter of the tube. Total length of the tube is 36 millimeters. The two parts meet at the isthmus, which is the narrowest part of the tube. The cartilaginous part is made of a single piece of elastic fibrocartilage which is folded upon itself in such a way that it forms the whole of the medial wall, roof, and part of the lateral wall. Now, tympanic end of the tube is small and bony. it is situated in the anterior wall of the middle ear. Now the pharyngeal end of the tube is relatively large and slit-like. It is situated in the lateral wall of the pharynx, and the pharyngeal orifice is the widest part of the tube. Now functions of the auditory tube: it maintains the equilibrium of air pressure on either side of the tympanic membrane, and it protects the middle ear by preventing the transmission of high sound pressure from nasopharynx to middle ear, and it also helps the clearance of middle ear secretions by active opening and closing of the tube. Now the palate. Palate consists of hard palate anteriorly and soft palate posteriorly. The hard palate is a partition between the nasal and oral cavities. Its anterior two-thirds is formed by the palatine processes of the maxilla and posterior one-third by the horizontal plate of the palatine bones. The superior and inferior surface of the hard palate form the floor of nasal cavity and the roof of the oral cavity respectively. Anterolaterally, the hard palate becomes continuous with the alveolar arches of the gum. Posterior margin of the hard palate is free and provides attachment to the soft palate. Now arterial supply: this is by the greater palatine arteries from the third part of maxillary artery. Each artery emerges from the greater palatine foramen and passes forwards around the palate to enter the incisive canal. Now veins of the hard palate drain into the pterygoid plexus of veins and pharyngeal venous plexus. Now hard palate is supplied by the greater palatine and nasopalatine nerves derived from pterygopalatine ganglion. The greater palatine nerve supplies whole of the palate except anterior part of the palate behind the incisor teeth, which is supplied by the nasopalatine nerves. After hard palate we have the soft palate. The soft palate is a mobile muscular flap which hangs from the posterior border of the hard palate into the pharyngeal cavity like a curtain. It separates the nasopharynx from oropharynx. The soft palate presents the anterior or oral surface. It presents the anterior or oral surface and posterior surface, superior border and inferior border. The inferior border is free and forms the anterior boundary of the pharyngeal isthmus. A conical small tongue-like projection hangs down from the middle of the inferior border and is called uvula. Now this soft palate, it is made up of fold of mucous membrane enclosing five pair of muscles. These muscles are the tensor palati muscle, or tensor veli palatini is another name. Another is the levator palati muscle or levator veli palatini. We have a palatoglossus muscle, palatopharyngeus muscle, and musculus uvulae. And the functions of the soft palate: it separates the oropharynx from the nasopharynx during swallowing. It isolates the oral cavity from the oropharynx during chewing so that breathing is not affected. It helps in the modification of quality of sound. It protects the damage of nasal mucosa during sneezing, and it prevents the entry of sputum into the nose during coughing. Now soft palate is supplied by the lesser palatine branches of the greater palatine artery, ascending palatine branch of facial artery, and palatine branch of the ascending pharyngeal artery. Now nerve supply: all the muscles of soft palate are supplied by the cranial root of accessory nerve via pharyngeal plexus except the tensor palati. Tensor palati is supplied by the nerve to medial pterygoid, which is a branch of mandibular nerve. Now, general sensations from the palate are carried by the lesser palatine nerves to the maxillary region of trigeminal nerve and glossopharyngeal nerve.